Hello, my name is Dr. Brian McClelland, and today I'd like to review an article titled The Multivitamin Therapy for Recurrent Apthous Stomatitis, or Canker Sores. This is a randomized, double-masked, placebo-controlled trial. The authors were Lala and Choquette et al., and the source of this article was the Journal of the American Dental Association, 2012, pages 370 to 376. Recurrent Apthous Stomatitis, or RAS, also known as canker sores, is a common disease affecting an estimated 2.5 billion people worldwide. There are three clinical types, including minor, major, and herpetiform. People who experience major RAS develop large, painful ulcers that often last several weeks, approximately 6 to 8 weeks, and heal with scarring. The etiology of RAS is not well understood, which hampers the development of effective therapies for prevention or treatment. Several factors have been implicated, including genetics, stress, allergies, and autoimmunity. In addition, a substantial body of literature indicates that some patients with recurrent aphthous stomatitis have vitamin deficiencies, so the role of vitamin deficiencies in recurrent aphthous ulcers is not well understood. The study design was conducted by having a randomized, double-masked, placebo-controlled, parallel-arm, single-center study out of the Connecticut Health Center in Farmington. The participants were 18 years and older with a validated history of at least 3 episodes of idiopathic minor recurrent aphthous stomatitis within the previous 12 months, and they were eligible for the study. Exclusion criteria included smoking, pregnancy, recurrent use of multivitamins, or any over-the-counter prescription agents for RASs, as well as a diagnosis of systemic conditions that can cause oral ulcerations. Interventions. The active agent tested was a generic multivitamin supplement containing the U.S. Reference Daily Intake, or the RDI, of the essential vitamins A, B1, B2, B3, B5, B6, B9, B12, C, D, and E. They instructed the participants to take 1 capsule per day for 365 days and to record the use of their medicine /vitamin in their study diary. The participants completed written diaries consisting of data regarding duration of each RAS episode experienced during the study participation. They asked participants to bring in the bottles of the capsules at 6 and 12-month study visits so that they could count the number of remaining pills. However, the compliance with this request was suboptimal, I think that's code for poor, and they were therefore unable to obtain satisfactory data regarding pill counts. Outcome measures. The primary outcome measures were number and duration of recurrent aphthous ulcer episodes, or RAS episodes, during the 1-year study. They assessed normalcy of diet by using a validated normalcy of diet scale, which participants rated during their episodes. The highest ranking food they could eat each day ranged from 0 to no food to 10 full and normal diet. The sample size and statistical method. They calculated the study sample size on a basis of 80% power and 0.5 to detect at least a 65% probability that the randomly chosen participant from the multivitamin arm had a superior outcome defined as fewer episodes and episodes of shorter duration, or both. So the results of this study. There's a total of 160 participants in the study, 83 in the multivitamin arm and 77 in the placebo arm, and they had a comparable demographics. Baseline levels of B12, red blood cells, and folate were recorded across the 2 treatment arms. Baseline vitamin B12 levels were low in 14 of the 160 participants. So assuming this is a random cross-section of America, that would be 9% of us have a low B12 level. For the participants with low baseline B12, there was no statistical difference in the instance or occurrence of new RAS episodes during the study period between the 5 participants randomized in the multivitamin arm and the 9 randomized to the placebo arm. All participants reported a total of 779 new ulcer episodes. For 575 of these episodes, the participants underwent a clinical exam, and 77 of these episodes, or 13%, were not recurrent aphthous ulcers. So 13% of the people that thought they were having recurrent aphthous ulcers or having an episode were not. when they actually showed up for a clinical exam. Compliance with the study medication regime. Compliance rates were 63.3% and 54.8% for the multivitamin and placebo arms, respectively, based on the diary, not actual pill counts, which is a weakness of this study. Incidence of episodes. The results showed no statistical differences in the mean number of RAS episodes between the multivitamin arm and the placebo arm in the study period. Mouth pain during these episodes. They found no differences between the multivitamin and the placebo arms regarding worst pain, least pain, or average pain, or pain right now. In other words, no difference in pain. Limitations of this study include self-reliance or reliance on self-reported data from the participants to determine the presence and the duration of the RAS episodes, particularly since out of the examined patients, 13% of the episodes that the patients thought were ulcers and part of this stomatitis were not. Please note that the episodes that were determined clinically not to be RASs were removed from the study. Another weakness would be the extremely weak statistical analysis for only a 65% probability. Most studies that I see and review are 0.95 or 95% probability. This is at 65%. I can say I've never seen this before in a study. Many investigators in studies earlier found that high-dose replacement therapy with specific vitamins was helpful in the treatment of RAS in patients with documented vitamin deficiencies. The findings of this study suggest that in the U.S. population, routine screening of all patients who have RAS for vitamin B12 and folate deficiencies is not warranted. Repeat, not warranted. And in this study, the administration of multivitamins did not assist with recurrent Apthous ulcer stomatitis. Well, thank you for tuning in, and we'll see you next time. This is Dr. Brian McClelland in Spokane, Washington.